All right, we're gonna start on the pelvis at the iliac crest, which is located right here. And then we're gonna travel down the anterior side of that where we find the anterior superior iliac spine. And then if we keep traveling down here, you can feel his bone and his pelvis. Right here, there's another landmark, which is gonna be the anterior inferior iliac spine. All right, we're moving on to the femur where we have the greater trochanter. You can feel his femur right here. You wanna move your leg up and down. You can feel it rotating right here. The greater trochanter is gonna sit on top of the head of the femur, and then just below that is gonna be the lesser trochanter, and then Kyle will point to his pubic symphysis. Thank you. Next, we're moving on to the sacrum, which we can locate right here, past the lumbar spine. Just lateral of that is going to be if we go out lateral here on the pelvis, the posterior superior iliac spine, and then if we travel down that, it's kind of hard to locate here on Kyle, but we have the posterior inferior iliac spine below the posterior superior iliac spine. First, we're going to start at the ischial tuberosity, so we're going to locate the hamstring muscles right here. We're going to find right where they insert, right where the butt starts. Go an inch above that. If we find here, we can find right here is our ischial tuberosity. All right, so now we have the hamstring muscles, starting with the semimembranosus, which is the most medial one, runs right down here. The semimembranosus does hip extension, knee flexion, and medial rotation of the leg. Next, right in the middle, is the semitendinosus, which is just lateral to the semimembranosus, and it does hip extension, knee flexion, and medial rotation of the leg. Lastly, in the most lateral hamstring muscle is the biceps femoris that runs down here. The biceps femoris does hip extension, knee flexion, and lateral external rotation of the leg. Next, moving on to the gluteus maximus, which is up here, the big muscle that covers the butt, doing hip extension, hip external rotation, hip abduction, and hip adduction. Just above that is the gluteus medius, which does hip abduction, hip medial rotation, hip lateral rotation, and pelvic stabilization. Under these muscles down in here is the gluteus minimus, which does hip abduction, hip medial rotation, and pelvic stabilization. Next is the tensor fossa lata, which this muscle is right here on the most lateral part of the leg. And you have the iliotibial band that runs with it down to the knee. The tensor fossa lata does hip abduction, hip flexion, hip medial rotation, and stabilizes the knee, while the iliotibial band, which connects to the tensor fossa lata, stabilizes the knee, assisting in hip abduction and supporting the lateral hip and thigh movements. First, we have the iliopsoas muscle in the pelvis. This does hip flexion, external rotation of the hip. Next is the pectineus, which is down here. It's hard to palpate. The pectineus does hip flexion, hip adduction, and assists in medial rotation. Next is the adductor brevis, which is just distal to that. The adductor brevis does hip adduction, hip flexion, and medial rotation. Just distal to that would be the adductor longus, which does hip adduction and assists in hip flexion and also assists in medial rotation. Below most distal would be the adductor magnus, which is sitting right about in here. That does hip adduction, hip extension, and assists in medial rotation. Last, coming down here, is the gracilis, which runs along here. That does hip adduction, knee flexion, and medial rotation of the leg. Next, moving on to the quad muscles. First, we have the rectus femoris, which runs right in the middle of the quad. The rectus femoris does hip flexion and knee extension. And next, we have on the quad muscle the sartorius, which runs from lateral out here and then comes in medial. The sartorius does hip flexion, hip adduction, hip abduction, and hip external rotation, knee flexion, and medial rotation of the leg.
Thank you.